Hello everyone, here I am starting an important topic, that is wound healing. So let's start wound healing, that is repair and regeneration. So before starting the topic, let me advise you to have a look on all the long questions, short questions, very short questions and MCQs which are related to this topic. So they are given in the notes section of the app as well as university exam question bank section, so that you will have an idea that from this topic which questions are important and the questions are asked in which format. So you will have a broad idea. So let's start the topic. So here, this topic I'm going to discuss under following headings. First of all, I will let you know what is the definition of healing. Then I will let you know the two mechanisms of healing, that is repair and regeneration. Out of repair and regeneration, the repair is important. We will see the steps of the repair, not the regeneration. We will see the definition of the regeneration, but we will see the steps of the repair. In the repair, there are three steps, three phases. We will discuss them in detail. The first is inflammatory phase, followed by proliferative phase, followed by maturation phase. So let's start it. So first of all, let me tell you what's the definition of healing. What is healing? It's the body's response to injury. For example, if I get injured anywhere on my body, so I'm having an injury here, there, here, anywhere. So my body will respond to that. So healing is body's response to what? To injury anywhere on human body. Why the body is responding? In order to do two things. Body want to restore the normal function and restore the normal structure. So in order to restore normal structure back and normal function back. So if I'm having an injury, just suppose here, anywhere on the body, so the normal structure and normal function both are impaired. Now the body will react, the body will show the response in order to restore the normal structure of the injured area and the normal function of the injured area. So this is the definition. Don't mug up the definition, understand the definition. You can write in your own words. So what is healing? It's the body's response to injury in order to attempt two things back. So in order to attempt the normal structure back and normal function back. That is healing. Now, there are two mechanisms of healing. Body can do healing by two different mechanisms. Number one, regeneration, and number two, repair. What do you mean by regeneration and repair, and what is the difference between them? Have a look on the diagram, a beautiful diagram given to you. You can see this is the normal tissue. Can you see the normal tissue? In the normal tissue, you can appreciate this is epithelium here. This is all epithelium, and below the epithelium, this is subepithelial tissue. This is normal tissue. Now it get injured. Now we have to see whether the injury is superficial. I mean the tissue is lost in injury. It is very superficial tissue lost, or there is a deep injury. You can see. Now based on that, the body's response to the injury can be different. If the injury is superficial, so body will do the regeneration. In regeneration, what is there? So whatever parenchyma is lost, here some parenchyma is lost in the injury, na? So it is restored by the same parenchyma. It is restored by same parenchyma. So the parenchyma is replaced by the same parenchyma. It is the same parenchyma. So 100% restoration of the normal structure, normal function. After regeneration, it's 100% restoration of normal structure and normal function, and the end result is normal tissue only. End result is 100% same tissue, normal tissue. So that is regeneration. That is possible only in superficial injury. Now have a look on the other diagram. In the other diagram, you can see this is deep injury. In the deep injury, the gap is more. Can you see? The edges are separated more. The gap is more. Now here, the same parenchyma will never come. No, here. So here in the gap, the fibrous tissue, the collagen, the fibrous tissue will be filled. So here the parenchyma was there. Now the parenchyma is lost. Now the parenchyma is replaced by the fibrous tissue, not by the same parenchyma. So here 100% restoration of normal structure and normal function never take place. And end result is scar formation. So tell me the difference between regeneration and repair. So healing is of two types, regeneration and repair. These are the two mechanisms of healing. So we have seen what is healing. It's the body's response to injury. And there are two mechanisms, regeneration, repair. Regeneration takes place whenever there is superficial injury, and repair takes place whenever there is a deep injury. In regeneration, the lost parenchyma is replaced by the same parenchyma. Parenchyma is replaced by the same parenchyma. So 100% restoration of the normal structure as well as normal function. So whatever was lost, it is regained. And here, the lost parenchyma is replaced by fibrous tissue. It is replaced by fibrous tissue. It is not replaced by the same parenchyma. See, here it was replaced by the same parenchyma. Here it is replaced by the fibrous tissue. So here 100% restoration never occurs. Neither of the 100% restoration of the normal structure, neither of the 100% restoration of the normal function. It never occurs. Here The end result is the same tissue. Whatever is lost, the same is regained in the end. Okay, but here the end result is scar. So please understand, draw the diagram, understand it well. So you have to write the definition of healing, then you have to write the two mechanism, write down the differences between them and draw this diagram very well. Now, out of the two mechanism, I will not teach you regeneration in detail. Now, repair is important. Regeneration, there are no much steps here. Now, you can see the same parenchyma is replaced by same parenchyma, but we have to understand how does the scar form. So, let me continue with the repair. So, I will teach you here the steps of the repair. So, there are three steps, three phases. There are three phases and three steps in the repair. The first phase is inflammatory phase, the second phase is proliferative phase, and the third phase is maturation phase. So, one by one, we will see all of them. The three phases. I am teaching you repair. Regeneration definition is sufficient. Now repair ka steps. So first come on the inflammatory phase. One by one we will see the three phases. In the inflammatory phase, what will happen? Two things will happen. Number one, the clot formation, and number two, inflammation. The clot formation and inflammation. You can see clot formation is hemostasis and inflammation. Let me explain you. Now first understand this diagram. If you want to understand the steps of the repair, understand this diagram. In this diagram, you can see this is epidermis of the skin. We have skin, so this is epidermis. Below the epidermis, we have dermis, and below that we have subcutaneous tissue. So you can see this is epidermis of the skin. Appreciate the epidermis, and inside the epidermis we have cells. The cells are keratinocytes. So these all are keratinocytes. Please appreciate the keratinocytes. So this is all epidermis you can see, and this is the keratinocytes in the epidermis. Below the epidermis we have dermis. So appreciate this is all dermis, and below that this is the subcutaneous tissue. So this is epidermis, this is dermis, and this is subcutaneous tissue. Appreciate the three layers of the skin. Just suppose I got a cut over here. Imagine I got an injury, I got a cut. So what will happen here? Here, the adjust of the injury will get injured area will get separated from each other. So I want you to appreciate the edges of the injured area. So this is, you can see the edges. They got separated from each other. I got a cut over here. So the epidermis got separated, the dermis got separated. You can see. So there is a gap. There is a gap formation. So as soon as I have the cut, what will happen? You say, ma'am, you will bleed. So anywhere we have injury, we bleed. So first thing is clot formation. We will bleed for how long? We will bleed for the next few seconds or next few minutes. After few minutes, bleeding stop automatically. Have you ever thought why the bleeding stop automatically? Because of clot formation, hemostasis or clot formation. Thankfully, God has given us this physiological mechanism in which whenever we bleed anywhere on the body because of the injury, so clot is formed. So you can see as soon as the cut is there, you can see in the dermis, these are the blood vessels. Appreciate the blood vessels in the dermis. Just a second, let me highlight it. These all are the blood vessels. These all are the blood vessels in the dermis, you can see. Now from them the platelet will come. Can you see? These all are the platelets. So platelets are arriving in the space and they are forming the primary clot. And after that, first platelet activation, platelet adhesion, activation, aggregation. Primary clot is made up of platelet. Followed by coagulation cascade will come. And you can see this is all fibrin. The fibrin will stabilize the primary clot and convert the primary clot into secondary clot. So first thing is clot formation. If I'm having a cut, I'm having an injury anywhere on any my body part, any human being can have that. So we bleed. The bleeding stop by clot formation. So first thing occurs clot formation. That is inflammatory phase. So as soon as we have the injury, see, as soon as we have the injury, the first thing is vasoconstriction and followed by platelet adhesion, platelet activation, platelet aggregation, because of which the platelet clot is formed. The primary clot is made up of platelet, followed by activation of coagulation cascade. The coagulation cascade will lead to the formation of secondary plug. That is fibrin plug, the secondary plug. So first primary clot is formed, then secondary clot is formed. Now from this blood vessels, you can see these are the blood vessels. No? These all are blood vessels. I told you they are present in dermis. So from the blood vessels, first the platelet were coming, filled the clot. Then the fibrin will come, fill the clot. So primary clot is formed, secondary clot will form. Now from this blood vessel, the neutrophils will come here in the space, in the gap, neutrophils. So you can see these all cells is multilobated nucleus. If you can appreciate, if you can zoom and appreciate, these all cells are multilobated. These all are neutrophils. Now the neutrophils will come. Okay, the first 24 hours, neutrophils are there. First 24 hours of the injury. After that, the neutrophils are replaced by, after 24 hours. After 24 hours, the neutrophils are replaced by macrophages. Now please appreciate these all cells here in the gap. They have single nucleus. These are mononuclear. These are macrophages. So appreciate these cells and appreciate these cells. So first neutrophils are there and then macrophages are there. So I hope you got it. So first, as soon as we have the injury, this is the gap. So what happens? what happens? So first, clot formation take place. So first from the blood vessels, platelet are coming. So platelet are coming forming the primary clot. This is all platelet I am drawing. This is all platelet. They form the primary clot. Followed by the fibrin will come. This is all fibrin. It is like thread-like structure because of activation of coagulation cascade. So this is all fibrin that will convert the primary clot into secondary clot. So first thing is clot formation. Let me write the clot formation. The clot formation or hemostasis. Followed by, now from the blood vessels, neutrophils will come. So these all cells, I am trying to draw the multilobated nucleus. I want you to draw these diagrams in your exam. That's why I'm drawing for you so that you can have an overview how to draw it. In the first diagram, draw the platelet, draw the fibrin and label it as a clot. In the second diagram, draw the neutrophils, maximum neutrophils. Show the multilobated nucleus and label them as neutrophils. And label it is inflammatory phase, the first 24 hours. And after the first 24 hours, the neutrophils are replaced by which cell? Now I will draw the macrophages here. These are all macrophages. So let me label it. Labeling in the diagram is important. So this is how the second prof students, I want you to have an approach that how to draw the diagram. These two together is known as inflammation. So first clot formation followed by inflammation. This all takes place in inflammatory phase. In inflammatory phase, first clot formation followed by inflammation. So what happens in inflammatory phase? I am teaching you 3 phases. The first phase is inflammatory phase. So you tell me what happens in inflammatory phase? In inflammatory phase, as soon as we have the injury, number 1, the platelets come in the gap. The platelets will form the primary clot. Followed by fibrin will come because of activation of coagulation cascade. The fibrin will come. Okay, just a second. Let me write it. So followed by fibrin will come. Okay, just a second. So fibrin will form the secondary clot. So clot formation is over. Now, the first 24 hours, neutrophil will come. And after 24 hours, the macrophages will come. Neutrophils are replaced by macrophages. So clot formation and inflammation. The two things, clot formation and inflammation. The two things takes place in inflammatory phase. I hope I'm crystal clear. So I want you in inflammatory phase to draw the flow chart, and whatever you are drawing in the flow chart, show it in the diagram. Show the clot formation, show platelet also, show fibrin also, label platelet, label fibrin. Then show neutrophils in the first 24 hours. And after 24 hours, show the macrophages. We are done. The inflammatory phase is done. Okay. After inflammatory phase, let's come on the second phase, the proliferative phase. In the proliferative phase, 3 things happens one by one. First thing is epithelialization, second thing is fibroplasia, and third is angiogenesis. Let me explain one by one. So all 3 I will show you in this diagram. You will say, what do you mean by the 3 terms? Let me explain. So first thing is epithelialization. Now here you can see whenever we have an injury, you can see this is epidermis. Now I told you this is epidermis. This is epidermis. Now they are I got a cut over here. So the epidermis got separated from each other. You got my point? So there is a gap. You can see there is a gap between the epidermis. Can you see the gap? Now here you can see these are the keratinocytes which are present at the edge. Here also keratinocytes are present at the edge. So the keratinocytes present at the edge, they will get activated, they will get stimulated, they start proliferating and migrating towards each other. So these keratinocytes migrate towards this side and these keratinocytes migrate towards this side and they will meet at the center. Can you see the gap is filled? They are meeting at the center. This is known as epithelialization, in which the keratinocyte proliferate and migrate towards each other and they meet at the center. Say, what do you mean by that? So here we have a gap. This is the gap. So this is epidermis. Okay, and below epidermis we have dermis. So currently I am interested in epidermis. So these are the keratinocytes. These all are keratinocytes. Okay. So the keratinocytes which are present here, they will get stimulated. They will proliferate and migrate towards each other. They also migrate here, and they will meet at the center. So this is known as epithelialization, the first step. Okay. After that, fibrogenesis is there. Now you tell me, what were the cells? What is the sequence of the cells coming in the gap? So I told you the first cell which were coming here is platelet. The platelet were coming and forming the primary clot. Now, after the platelet, the next cell which were coming here were neutrophils. I told you, the first 24 hours, the inflammatory cell will come. What is the inflammatory cell we have here? That is neutrophil. Okay. So here neutrophils will come the next 24 hours. Within the 24 hours. And after neutrophils, they are replaced by the macrophages. So macrophages will come. So first platelet will come, then neutrophils, then macrophages. Now platelet are gone. Neutrophils are also gone. Now macrophage will also gone. And instead of that, the fibroblast will come. Finally, the fibroblasts are coming now. So in fibrogenesis, the fibroblast will come in the gap. These are spindle-shaped cells. So appreciate the gap first. I want you to appreciate the gap. I want you to appreciate the epithelium of both the sides got merged with each other because of epithelialization. Now in the gap, I want you to appreciate these all are macrophages. Now they are decreasing in number. And instead of that, another cells are coming. With cell, the fibroblast. I want you to appreciate the fibroblast. I want you to appreciate all these fibroblasts. Okay, what does fibroblast do? Fibroblasts form collagen. So they start forming collagen. In the background, you can see the thread-like structure. I don't know whether you can see or not, but you have to draw it clearly. Okay, so in the background, you can see the collagen band that is filling that effect. So you have to draw like this. Okay, so this is the gap. Okay, this is the gap. Draw the epidermis. Okay, the first thing you have to draw the keratinocytes here. The keratinocytes here, they move each other and they are filling. They are combining at the center. They are merging at the center, I must say. This is epithelialization. The epithelialization is over. Okay, after that, now the cells I will draw here is fibroblast. I will draw few macrophages also, but macrophages are decreasing in number. First platelet come, they are gone. Then neutrophil come, they are gone. Then macrophages come, they are also gone. They are decreasing. And now fibroblast is coming. And fibroblast is forming the collagen. So in the background, I want to show you the thread-like structure. This is all collagen. So label it properly. Label it properly. So here I have shown you epithelialization. And here I have shown you fibrogenesis. What is fibrogenesis? Formation of collagen by fibroblast. Say it again. What is fibrogenesis? Formation of collagen by fibroblast. Okay, that is the second step. Okay, and the third thing which is taking place here is angiogenesis. What is angiogenesis? Formation of new blood vessel from the old one. New blood vessel from old one. From the old one. That is angiogenesis. Where are the blood vessels? Can you see the blood vessels here? Let me show you. Let me highlight. Let me erase this and let me highlight the blood vessels. Blood vessels are present in the dermis. So please see the dermis. Can you see the dermis? This is the dermis. So this is an old blood vessel. This is an old blood vessel. Now I want you to appreciate from this old blood vessel inside the gap. Can you see a new blood vessel is arising from the old one and entering inside the gap? Here also a new blood vessel is arising from the old one and entering inside the gap. Can you see these sprouts? These sprouts, the sprouting blood vessels, the new blood vessels which are formed from the old one. Appreciate it. So this is known as angiogenesis. So how does angiogenesis take place? Tell me the steps. Sometimes you get a short question on that. Separate short question, write the steps of angiogenesis. So there are 7 steps. Rather than mugging up, see all the 7 steps here. All the 7 steps. This is the old blood vessel. Old one from which the new will be formed. So I will tell you the 7 steps in this old blood vessel. The first step is vasodilatation. The old blood vessel get vasodilated. Number 1. Because of nitric oxide. Okay, so first step is vasodilatation because of nitric oxide. Okay, number 1. The second step is increased vascular permeability. What do you mean by increased vascular permeability? See, this is, okay, see the old blood vessel again. In the old blood vessel, can you see what are the layers? Say ma'am, the innermost layer is the endothelial cell. This is all endothelial cell. Appreciate. Hana, the endothelial cell. This is basement membrane. Can you see? This is basement membrane. On one side of the basement membrane, inner side of the basement membrane, endothelium. And the outer side of the basement membrane, you can see these cells are there. These are known as pericyte. So in the center, there is a basement membrane. On inner side, there is endothelium. On outer side, there is pericyte. So endothelium is continuous with each other. The endothelial cell. Can you see this cell, this cell, this cell? They are continuous with each other. Now, if the gap is formed, that is known as increased vascular permeability. Increased vascular permeability is formation of gap in the endothelial cell. Can you see here? So this is the endothelial cell, this is the endothelial cell, but in between the two endothelial cells, there is a gap. The formation of gap is known as increased vascular permeability. So first thing is vasodilatation, appreciate vasodilatation, and then appreciate the increased vascular permeability. I mean to say appreciate the gap. Appreciate the gap. Number 2. Now gap formation is due to VEGF, vascular endothelial growth factor, vascular endothelial derived growth factor, VEGF. So vasodilatation is due to NO and increased vascular permeability is due to VEGF. Now the pericyte are separating from each other. Can you see? This is the pericyte. Let me show you. This is a pericyte. Okay. And this is the pericyte. They are separating from each other. You can see here pericytes were also continuous. So the pericytes are separating from each other. Okay. Now the basement membrane will break. The basement membrane will break. So first endothelium separate from each other. Then the pericyte separate from each other. Then the basement membrane will break. And then the endothelial cell will proliferate and go outside. Can you see? Endothelial cell is proliferating and growing outside. This is known as leading tip of the new blood vessel. The new blood vessel arising from the old one. So migration of the endothelial cell to form the leading tip. Okay, and they will proliferate. First they will migrate, then proliferate. They will proliferate And finally, the endothelial cell is there, the basement membrane is there, the pericyst will also come. So this is a new blood vessel. You all can see this one is the new blood vessel. You can see endothelial cells are proliferating, migrating, and basement membrane is there, and pericyst is also proliferating and migrating. A new blood vessel formed from the old one. So this is how the new blood vessel is formed from the old one. This is known as angiogenesis. Say the steps. The first step is vasodilatation because of nitric oxide. Second step is increased vascular permeability because of VEGF. Okay, third step is, now the endothelial cells are already separated. Now we have to separate the pericyst, pericyte. Pericyte cells are separated from each other. Now basement membrane will break. Basement membrane will break. So endothelial cell will migrate outside. After migrating outside, endothelial cells start proliferating. And finally, pericyte cells also start proliferating. These are the 7 steps. A new blood vessel is formed from the old one. Don't learn the step. Understand this diagram. Try to draw this diagram in your exam. So in your exam, you have to draw old blood vessel in which draw the basement membrane, draw the endothelium on the inner side, and draw the pericytes on the outer side. This is a old. Label it as old blood vessel. Now, how the new blood vessel is arising from the old one, show all the 7 steps here, label them. So this is how the steps of angiogenesis are there. So finally, the 3 things are done. And I am teaching you the second phase, proliferative phase, in which 3 things are there. Epithelialization, appreciate the epithelialization. The epithelium is merging with each other. Appreciate the fibrogenesis. The macrophages are going, the fibroblasts are coming, and fibroblast is forming the collagen. And appreciate the angiogenesis, the new blood vessel from the old one. So I will show you all 3 in one diagram. Let's draw it. Let's try to draw it. So let me draw the diagram. Okay, let me draw the gap. Let me draw the epidermis. These are the keratinocytes which are present at the junction, at the margins, at the edges. Okay, and this is all dermis. Below that we have the dermis. In the dermis, these are the old blood vessels. Okay, these are the old blood vessels are there in the dermis. Now this is the thing. Now I will show you the 3 steps. What are the 3 steps in proliferative phase? First, say ma'am, the first step is epithelialization, in which the epidermis keratinocytes migrate toward each other. Migrate, proliferate and migrate. They will proliferate, migrate, and they will meet at the junction. They will meet at the center. So epithelialization is over. Now here macrophages are present. Macrophages will reduce in number, and instead of that the fibroblast will come. And after the fibroblast will come, they will start forming the collagen. So the formation of collagen by the fibroblast is known as fibrogenesis. So epithelialization is done, fibrogenesis is done. The third step is angiogenesis, that is formation of new blood vessel which go inside the gap from the old one. You know the 7 steps, So this, see, I'm forming the new blood vessel. See, this segment is a new blood vessel which is formed from the old one. So this is angiogenesis. So there are 3 things. What are the 3 things? Highlight them. Can you please help me in highlighting? First is epithelialization, then fibrogenesis, then angiogenesis. So whatever product you can see in this gap, now in this gap, what you can see? We have the epithelialization, we have the collagen fiber formed by the fibroblast, and we have new blood vessel. So the summary of the 3 is known as granulation tissue. So the summary of the 3 is known as granulation tissue. So the end product of this phase is known as granulation tissue. So what is granulation tissue? In the gap, we have collagen which is laden by the fibroblast, and we have new blood vessel. So the combination of the 2 is known as granulation tissue. So phase 2 is also over. Phase 1 is over. Phase 2 is over. Now coming on the last phase, maturation phase. In maturation phase, what is happening? The collagen is already there. Now the collagen will start remodeling. The collagen is already there. Collagen start remodeling. So in the gap, what is the sequence of the cells? Can we revise the sequence once? So first cell which was coming as soon as there is the injury. Okay, as soon as there is the injury, the first cell which was coming was platelet. It was forming the clot. Okay, now platelet, the second cell which was coming is the neutrophil within the first 24 hours. The neutrophils were replaced by macrophages. Okay, the third cells were the macrophages. After 24 hours, 24 to 48 hours, the third cells were macrophages. Macrophages were replaced by fibroblast. Fibroblast was forming the collagen. This is the sequence. So first platelet, then neutrophil, then macrophage, then fibroblast. Finally, fibroblast will also disappear. And no cell. So platelet are gone within 24 hours. Neutrophils are gone after 24 hours. Macrophages are gone after 48 to 72 hours. Now, the fibroblasts are also gone. So it will become an acellular mass. It become an acellular mass. No cell is there. And these fibroblasts, you can see these are the fibroblasts. The fibroblasts, before they disappear, they form the collagen. So we have only collagen. We have only collagen. But initially the collagen was random, and here it become remodeled. So it is a remodeled collagen, the last step, maturation phase. So all the cells are gone. Fibroblasts will also leave. There is no cell. There is acellular mass. It contains only collagen that is remodeled, and it is known as scar. Now see this. You can see epithelialization already done. There is no gap. Epithelialization already done. Epidermis is meeting at the center. Now in the dermis, we can see few fibroblasts. Still there are few fibroblasts, but gradually they will also leave the wound. They all are fibroblasts. They will leave. It will become acellular mass. So finally scar is formed. What is scar? Say ma'am, scar is the acellular mass contain remodeled collagen. Remodeled, only remodeled collagen. That's it. That is the scar. So end product here is scar. End product in the last step was granulation tissue. Here the end product is scar. Scar. So it contains only and only collagen, which is remodeled. That's it. All the cells are left. So here the tensile strength of the wound is never 100%. I'm teaching you repair. At the beginning of the lecture, I told you healing is of two types: regeneration and repair. I told you when the injury is superficial, there is regeneration. So here 100% restoration of normal structure and function. Here 100% is never. Okay, so tensile strength is maximum up to 80%. That too after 3 months. But it is never 100. It's a very important MCQ they ask you in the exam. So please learn the tensile strength. So just suppose, whenever we were kids, we play, we fell down. So on our elbows or on our knees, we are having the injuries. Maybe you are also having that, right? So just suppose I'm having an injury over here, injury here, anywhere. So that area, scar is there. You can still have the marks of your scar. You can see in your adulthood also, you can remember, yeah, I was playing in a playground when I was a kid and I got injured here, and still till date I can see the scar here. I can see the scar. I can see the scar here, there. So the scar gives you the memories forever, right? So that area, just suppose I have a scar over here, for example. So this area skin is never as strong as the surrounding area. It is 80% of the surrounding area. That is the meaning. So 100% tensile strength is never regained. Never, never, never. Maximum 80% after 3 months. So that is the meaning. I hope you all got it. So the skin in the scar area is weaker as compared to the surrounding area. That is maturation phase. So the 3 phases are done. What are the 3 phases? Say ma'am, inflammatory phase, proliferative phase, maturation phase. The same diagram you can see. So you can see in the inflammatory phase, first platelet will come, then neutrophil will come, then macrophage will come. In the proliferative phase, the epithelialization takes place. Appreciate the epithelium is coming towards each other. It is meeting at the center. Then you can see the fibroblasts are forming, coming and forming the collagen, and angiogenesis takes place. And here finally acellular scar. Acellular scar. Okay, so I hope you got it. So in the exam, the most important thing, the second prof MBBS student, you have to draw the diagrams of all the steps. Draw the flowchart, draw the diagram. That's it. Inflammatory phase, proliferative phase, maturation phase. Inflammatory phase, draw these diagrams. Draw these diagrams. This is, let's revise it quickly. So I will show you the diagram. In inflammatory phase, draw 3 diagrams. In proliferative phase, draw 1 diagram in which you have to show all these 3 things. And in maturation phase, also draw 1 diagram. Let's revise it quickly. So here in the inflammatory phase, you can see this is the gap. This is the gap. And here, this is the gap. Okay. So first thing, you have to show the platelet. These all are platelets. Platelet will form the primary clot and the fibrin will form the secondary clot. So clot formation. The first thing you have to show, label 2 things, platelet and fibrin. Platelets and fibrin. That's it. The 2 labeling is there. And it is the clot formation. Followed by these all are neutrophils. Label them as neutrophils. These all are, and within 24 hours. And after that, they are replaced by macrophage. So label it as macrophage. So this is, and you can show it in the same diagram also, but you have to draw the phases. First clot formation, then neutrophil, then macrophage. This is inflammatory phase. We are done with inflammatory phase. Coming on proliferative phase, in one diagram, I will show you 3 things: epithelialization, fibrogenesis, angiogenesis. So you see. So here you can see the epidermis coming towards each other and merging at the center. This is epithelialization. Fibrogenesis is fibroblast. You can see here, fibroblasts are there. They are forming the collagen. Formation of collagen by fibroblast is known as fibrogenesis. Okay, fibroplasia. Okay, and formation of new blood vessels from the old one. You can see the new from the old one. This is a new blood vessel arising from the old. A new blood vessel arising from the old. This one is angiogenesis. The summary of the 3, the end product of the 3 is known as granulation tissue. And finally, it's maturation phase. So you can see everything will be gone. Only collagen will be there. It will be acellular. Fibroblast will also leave the wound, leave the healing area. It is only collagen which is remodeled. It is remodeled collagen. So that is scar. So I want you to draw these diagram along with the description, along with the flow chart. These are the steps. So if this question is coming for a long question, in the long question, you can get a question on the healing. You can get a question on the repair. Okay, healing is of two types. Regeneration, you just write down the definition. Repair. So ultimately, if the question is coming on healing or the question is coming on repair, you have to write down this. So first, write down the definition of the healing. Write down the two mechanisms, that is repair and regeneration. Draw diagram, show differences, and repair the 3 steps of the repair. Draw the 3 diagrams of the 3 steps, please, and draw the flow chart. I hope if you are going to write this, you are going to fill your 5 to 6 pages on that, and you will get full marks. So how many of you are confident now? So before going to your exam, please revise the headings under which you are going to write that answer. So if healing is coming in my exam, first I will write the definition, then I will write the 2 mechanisms, repair and regeneration. I will take the repair. In the repair, I will say the 3 steps. Inflammatory phase, proliferative phase, and maturation phase. I will draw the flow charts. I will draw the diagrams. So this is my overview, and in the exam, I can regenerate it very well. I hope you all got it. Thank you so much. Before ending the session, let me advise you again. Have a look on the long question, short question, very short question, and MCQs which are given in the notes, so that you will have an idea. Now you are prepared for all the questions from this section. Thank you so much. Let's end this session.